Hello everyone, this is question 9 of our 100 clinically oriented anatomy questions. Let's get straight into the video. The question says a 45-year-old male presents at the local emergency clinic with a complaint of a painful knee and difficulty in walking. A CT scan examination reveals a very large cyst in the popliteal fossa compressing the tibial nerve. Which movement will most likely be affected? There's a flexion of the foot, flexion of the thigh, extension of the digits, extension of the leg, plantarflexion of the foot. So I've underlined the most important thing that we need to look out for in the question, which is compression of the tibial nerve. So compression of the tibial nerve will affect which of these motions? First off, let's rule out this option B. Option B is not part of what we should be considering at all. So option B should not be part of what you should be considering at all. I mean, the tibial nerve does not control any movement in the thigh, so it is not part of what we should be looking at. Then dorsiflexion of the foot, extension of the digits, extension of the leg, plantarflexion of the foot. So the tibial nerve supplies the posterior leg muscles, and the posterior leg muscles are specifically involved in plantarflexion of the foot and the flexion of the toes. So plantarflexion of the foot and flexion of the toes, those are the two things that the posterior leg muscles do. All right, that's what they do, and they are supplied by the tibial nerve. So the posterior leg muscles are the gastrocnemius, the plantaris, the soleus, tibialis posterior, flexor hallucis longus, and the flexor digitorum longus. So they help in plantarflexion of the foot, which is option E, and then we have our correct answer to be option E. So option E. All right, let's check why the other options are wrong. Dorsiflexion of the foot. Dorsiflexion of the foot is carried out by the anterior compartment, which is supplied by the deep peroneal nerve. All right. So it means option A is also out. Then extension of the digits. Extension of the digits is also carried out by the anterior compartment of the leg. So dorsiflexion of the foot and extension of the digits are carried out by the anterior compartment of the leg, and they are supplied by the deep peroneal nerve, which means this is also wrong. An extension of the leg occurs at the ankle joint. Yes, extension of the leg occurs at the ankle joint, and that is controlled by the quadriceps femoris, which is supplied by the femoral nerve. So that is definitely not our correct answer. So the correct answer is a plantarflexion of the foot, which is controlled by the posterior leg muscles supplied by the tibial nerve, and that is the correct answer. I hope you understand and you enjoyed the video. Make sure you like, comment, and subscribe to my channel, and I'll see you in the next episode. Thank you.